for a number of our folks to catch up, and we'll be getting started in just 1 minute. Folks can catch up. Again, my name is Dave Warsnick, and welcome to Billing, our part 2 of our Billing CTEC Billing series. And today we'll be discussing dealing with denials. We're very pleased to have with us Rita Guido, who's the Outreach Supervisor from Computer Sciences Corporation. I think that you'll find her presentation to be very useful. Just a couple housekeeping pieces. Given that we've had over 600 folks registered for this, obviously we're keeping everybody, with the exception of the panelists, on mute. But what we would ask you to do is to check your questions in as we go along. The chat box should be on the lower right-hand corner of your screen. If you don't see the chat box, if you look up on the upper right-hand corner, you should see a little blue circle that says chat. If you click on that chat circle, then your chat window will open up and you'll be able to chat questions to us. What we do request is that when you do chat in a question, you'll see a drop down on the chat at the bottom. It says send to. We'd ask you to select send to all panelists. That would make sure that the questions get through to us. I'll be monitoring the questions during the course of the presentation, and we should have time at the end to answer as many questions as we can. We're going to start with a polling question. That's teed up. You'll see the polling question on the right-hand side. We're going to open that up for about 30 seconds or so, and please tell us what your primary role is with the agency so we have a better idea of who is involved in today's presentation. So we'll let that run for 15 more seconds or so, and then we'll tee up the answer. Okay, Grant, if you'd like to shut that down and see what we're looking at here. 1 second. It'll take a second for the results to come through. Okay, so our results came through. Good. We have a good percentage of our staff, 72 out of our participants, 72 out of 247 are billing staff, with directors and administrator, 20 out of the 247 are reimbursement supervisors. So very good. Again, this series was designed primarily for billing staff and for our reimbursement supervisors, so I'm glad that that's the majority of the folks. So the agenda for today, made our introductions. We're going to hand it over to Rita in a second, and she'll review remittance advice, rejections versus denials, tools to research rejections and denials, common denials, and then some tips. At the end, she'll show you a couple of quick resources that you'll find useful. We'll take questions. Again, I'd like to remind everybody that we do have office hours scheduled for this Friday. That will be from noon to 1 o'clock. What we will be doing at that time is answering any questions that either you send in during the course of the week or that we'll be unable to get to today. So without further ado, I'm going to hand control over to Rita, and thank you for joining us, and I'll be back to talk with you at the end of the presentation. Rita?
Hello, everyone. Again, I'm Rita Guido. I'm the Outreach Supervisor from Computer Sciences Corporation. And as was just stated, we're going to go through the items that you saw on the agenda and have some time for some questions at the end, obviously. We're going to start out with the remittance advice. And what we find with Medicaid billing is that people don't really think of this as their key document, a key set of information. So the remittance advice is extremely important. People should be looking for it every week. They should be responding to the information that's on that remittance statement every week and following up. So it's really your main control document. So what this remittance advice is, it's something that contains a listing of all the claims that you've sent to Medicaid that have entered the claim processing system during that particular cycle. It'll show you the status of each of those claims. It'll tell you whether they denied or they paid or were pended. It'll also tell you if they were adjusted or voided after they were processed. It'll tell you the edits or errors that were failed by that particular claim, if they did pend or were denied. So those errors are incredibly important for you to pay attention to, and then learn how to resolve those. It also shows the payment information and other financial information, such as things like recoveries, recoupments, any negative balances that are showing up on your provider file based on either claim activity or recoveries that have been done. And it's such an important tool for identifying and correcting any of your billing errors. This remittance statement contains the 16-digit transaction control number, which is also known as the payer claim control number. That's needed when you're trying to do an adjustment or what's also known as a replacement claim, as well as voids and again, you can only do those to previously paid claims. So that 16-digit transaction control number is very important. So we'll talk a little bit more about that in a moment. So your remittance advice comes to you in a couple of different formats. So you can receive your remittance statement either through a HIPAA-compliant electronic 835 file. That remittance format needs software in order to interpret it, okay? So that might be software that you have on your computer. It might be software that your clearinghouse uses or your software vendor has available to put the information into some kind of format that you can read and understand. The next type of remittance format is the PDF remittance advice. And that looks just like a paper remittance advice, but what happens is rather than mailing the remittance statement to you, we actually put it on the emedne.org website, and from there you can go to a place on the Emedne website called the Exchange, and you can retrieve that remittance advice. And again, you should be going out there frequently to find these documents and these files. A paper remittance statement is just that, and we're going to talk about that in a little more detail in a moment, and I'll explain why. And the thing to remember about remittance statements is that you're going to get a separate remittance for each provider ID electronic transmitter identification number combination that you have on file with us and that you use for submitting claims. So for instance, an ETIN number, this electronic transmitter identification number, is a number that CSC assigns to a provider and allows you to communicate with us electronically so that we can go back and forth with you electronically for a number of different files and purposes. This number, you certify annually your connection to this number, and you can have multiple connections to different ETIN numbers. So for instance, one provider might only have one ETIN. Maybe all they do is do their billing through ePaces, which is Medicaid's web-based application. But other providers may have multiple ETINs. So they may have an ETIN number in order to use ePaces in their office, but they might also have an ETIN number for the billing they do using a vendor's software that they have installed on their computer, or they may have one that they use for doing billing through the clearinghouse if they're doing billing through a clearinghouse. So it's possible to have multiple connections to different, for a provider to have multiple connections to different ETIN numbers. So depending on who's submitting those claims, which ETIN is being used, you may get different multiple remittance statements. The delivery methods. How are we going to return remittance statements to you? So you've billed us, we've created a remittance statement telling you what happened to your claims that processed through the system. One way is through the Electronic Remittance Advice, the ERA, that's delivered to you either through the exchange or something called FTP, which is File Transfer Protocol method, or core services, delivery services. So there's different ways that electronic remittance advice, the 835s, can be returned to you. PDF remittances are sent to the exchange. You have to have an exchange inbox to be able to pick those up. Again, you need to have ePaces enrollment in order to do that. And what you really need to remember is that these files don't stay out there indefinitely. They stay out there for a limited period of time. So as far as the PDF remits go, you need to remember that you need to go and retrieve those files, those PDF remits, within 28 days of their being created and posted there. After that, you're in a position where you might have to ask us to regenerate them and would then have to pay a cost, depending on whether you were asking for a paper copy or you were asking to have, say, a whole new electronic remit. So you really need to remember timing. The paper remittance statements, which hopefully most of you are moving away from or have moved away from, those are sent obviously through the mail, through the U.S. Postal Service. And again, those are sent weekly as well. Things to remember about this is that Medicaid, now has a requirement for providers to be signed up for electronic fund transfer and to also be signed up for receipt of either electronic remittance statements, the 835s, or PDF remittance statements. They want to eliminate and get away from the paper remits. So annually, when it comes time to recertify that ETIN number, that electronic transmitter identification number, when you do that recertification, you may be told that you haven't done that aspect. You haven't signed up for electronic remit or electronic fund transfer. And you'll get a letter telling you what you're going to need to do. So do follow those directions really carefully. We also have some training sessions out there on our emedne.org website under provider training to try to talk you through some of the information on those forms. All right, we're going to move on to the next slide. Here we're displaying what a PDF remit and a paper remittance statement would look like. The reason I'm using this is just to talk about some key elements that are returned on all the formats, the electronic, the paper, and the PDF remits, because this is a little more, gives you a little more visual representation. Obviously, if you're getting an electronic remit, your software that you have for interpreting that is going to be putting that information into some type of report format for you, and they may vary from vendor to vendor. So we really can't display that for you. When we send you an 835 file, it's basically strings of data that then your software has to take and name and put into a report form. So I figured this would be a little bit easier in terms of discussing some of the key elements that you need to watch for when you're looking at remittance statements. First of all, we're going to tell you, who the remittance statement is for. You can, on paper, you can see we're telling you it's for ABC Mental Health Services on the top left. We'll give you the date it was created and a cycle number. We'll tell you what type of remit it is. In this case, a clinic APG remit. We're going to tell you the provider number and NPI and the remittance number. Each remit is given its own unique number. As you move through and you look at some of the columns on this remit, you can see we return back to you the office account number that you gave to us on your claim. We'll tell you the client's name and client ID that you gave to us. The transaction control number, remember I said there's a 16-digit number we assign. Everything that you see on this remittance statement is going to have a transaction control number. When it comes to doing adjustments or replacements of claims or voids of previous claims, you can only use the number that relates to something that says the word paid over to the right or to the most recently adjusted claim that actually went through and processed as an adjustment, as long as it didn't deny. So it's really important that you remember you can only adjust or void a previously paid claim. And I see that as a problem frequently, where people are pulling the wrong TCN number. They're trying to rebill a claim with a TCN number of something that denied, for instance. Okay, other information on here, a couple of things to think about when you see these TCN numbers. The first 5 digits of the TCN number are actually the date that we would have received and processed that claim. So the first 2 digits of the year, so something that you sent this year would have the first 2 digits as 15. And then the next 3 digits of that TCN number are the Julian day of the year. So if there are 365 days in the year, day 1, January 1st, is going to be 001. The last day of the year, December 31st, is going to be day 365. So you'd see 15001 for January 1st. So then you know roughly when you sent this to us for processing. Okay, you're also going to see the date of service that you told us on the claim, the rate code, and that rate code is a 4-digit number. If you look there, we're pointing to it with the yellow number 10 that you see on the screen. That rate code is a 4-digit number used on institutional claims, and it's assigned to you by the state. You need to make sure that you have that rate code on file for the location that you're utilizing on your claim. That's identified by your correct zip +4. So it's important that you know what rate codes you have on file for which locations and which specialties you have on file for which locations, et cetera. And you do get notification of that from the state when those things are set up. And you can also contact us. If you're not sure what information is on your provider file, there's a way that you can contact us and request a report with some of that data. That form for requesting that information is found on the emedney.org website. And you can also contact our call center and somebody can direct you. You're going to see the amount that was charged and the total amount that we paid, and importantly, we're going to tell you the status of the claim, whether it paid, pended, denied, or was an adjustment or a void. And then last but not least, on the right-hand side, you see the error column. And on a paper remittance statement or the PDF remittance statement, those error codes are 5-digit numbers that are very specific to New York Medicaid. They're called edits, and they're basically the hurdles your claim has to get over in order for us to process the claim and pay it. When it hits one of those edits, you're going to see that edit number appear in that far right column. And then at the end of the remit, we'll explain to you what that edit is. On an electronic remittance statement, the codes that are returned are HIPAA-compliant codes, and we're going to show you some of the information and how it correlates to the edit number. But what you have to remember is that there are more Medicaid edit numbers than there are HIPAA-compliant codes that can be returned as claim adjustment reason codes or status codes on the HIPAA-compliant response files or 835 remittance that will be returned to you if you're getting those type of responses. So it's very important that that you know where some of the resource material is that you can use to look up some of those codes and narrow it down to figure out what's wrong with the claim. That's done through something called the edit error knowledge base that we're going to talk about a little later. So moving on, if you look on the bottom half of that list of column headings, you'll see like item 1 says the CPT code. So if you sent us a claim that had multiple claim lines, if you look at the example down below where that number 9 is pointing, first you're going to see the transaction control number that was assigned to the claim and the total amount that we paid for everything on that claim, all added together. Then you're going to see the account number that you gave us on each line of that claim. So if you had a claim that had 2 procedure codes that you did during that encounter, you're going to show us each of those codes, and we're going to return them on your remittance statement telling you, here's the code you billed to us, it's part of this transaction control number. We're going to tell you also the APG that was assigned, that code fell under, the grouping that particular procedure code fell under, and then you're going to see the weight of that procedure code, the full weight, and then if for some reason it needed to be reduced by some percentage, you're going to see what percentage that weight was, the multiplier effect was, so 90% of that weight, 100% of that weight. And then you're going to see the amount paid on each claim line. If there's a capital add-on, you'll see that, and so on. So you can see there's a lot of information that gets returned on a remit, whether it's electronic, PDF, or paper, and all of that should help you to identify if you're billing with the information you thought you should be sending to us, you know, that actually took place during an encounter. You can go back and look at it and say, oh, gee, my system didn't send this extra procedure code. I wonder what happened. You know, was it an inputting issue? Was it a problem with my software? And so on. So you can go back, and this is really your key control document to compare to what should have been done and then follow up if something needs to be done differently. I want to talk a little bit about the difference between rejected claims and denied claims. And there's a big difference between these two things. So a rejected claim is a claim that's failed what we call a front-end rejection, a pre-adjudication rejection. So that claim came to us. You tried to hand it to us electronically, and we looked at it and said, nope, we stood at the front door and we sent it back to you and said, can't take it from you. So if a claim is rejected for one of these pre-adjudication edits, it's not going to appear on a remittance statement. Okay, and it's very important that you understand that. So if somebody says to me, gee, Rita, I billed you 3 months ago and I still haven't seen anything on my remit. What are you doing with my claim? I have to say, go back and take a look at your files that tell whether something was rejected or not. And that file is the 277 CA, the claim acknowledgement file. Or you could also look at the claim status response that you can obtain through a couple of different methods, one of which would be e-PACES. And there are codes that come back that tell whether something was, you know, accepted or rejected. And there are code numbers A1 through A7, and then additional code numbers to further define why it was rejected. And it's very important that you refer to those files. And if your vendor's not providing them to you, you need to make sure that you find a way to get that information, even if you have to go into e-PACES to look it up. So the denied claim would be, you know, the next step. So if something got through the front end, the pre-adjudication editing, it would go on to the mainframe editing, and those claims would actually make it into the eMedNI system for claim processing. And any of the claims that get in that far then would show up on your remittance statement as either paid, pending, or denied. So if something denies at this point, it's gone through the whole system, that's going to be reported on your remittance statement. And if you were to check claim status, say for instance on e-PACES, prior to receiving your remittance statement even, you could do this fairly shortly after submitting your claim, I would say within a few hours or the next morning, you could check the claim status on e-PACES and find out if it actually was rejected or if it was actually rejected or denied. Other type of claims, if they pend, they get through the front end and they actually get into claim processing. If they pend rather than pay or deny, those, if they are showing up on your remittance, on the paper, they'll show up on the remittance say pend. If if you're receiving an 835 electronic remittance statement, they're going to show up in what we call the supplemental file, or the 835F, and that's where your pending claims will appear. Those are claims. Sometimes you'll look through those edits and you'll know that maybe you need to contact do something, or contact the patient to do something about their eligibility or some other issue. You know, there's a variety of reasons why claims pend, pay or deny. Pend or deny. So it's really important that you understand the difference between a rejected claim and a denied claim, and that you understand that you need to be checking from the moment you send your claims out to see if something is being rejected at the front end. Because if you wait and you don't follow up on them quickly enough, you won't be able to rebuild them, okay? Because they will have exceeded the timely filing limits. So rejected claims, if we go on to the next slide, rejected claims, there's a place on the emedney.org website. It's found by going to emedney.org, and you're going to go to the HIPAA support tab on the top row of the emedney.org page, and you're going to look for crosswalks. And within those crosswalks, there's a pre-adjudication crosswalk. And this document has several pages, but essentially what it does is it tells you, it explains the code numbers that are coming back to you. Say, for instance, if you check the claim status after submitting the claim through ePaces or some other software, you'll see code numbers, and this table describes what codes are going to come back, describing what happened to your claim at the front end. And then if you look in that center column, it gives you the written description of why something may have rejected. It looks more complicated than it is. Some of this tells you you're either going to see this at a claim level or a line level. So you might have had a line error or an overall error. And then it tells you which type of claims these are going to appear on, these particular codes. But to long and the short of it, some really common reasons for things to be rejected at the front end as pre-adjudication edits are things like wrong, diagnosis codes, revenue codes that don't exist at all. Balancing is a really big issue. So, for instance, if you're showing us other insurance data on the claim after billing another payer, and your numbers don't add up correctly to the amount that you charged, then you're going to have a balancing rejection. And those just don't even get past the front door. So they'll be rejected. You'll see code numbers in that first column. So you might see a code number that says A7, and then another number in the next column, and it may be possibly a third identifier that describes that maybe it's out of balance, or there's a bad, some other bad piece of information like an NPI or something. So there are certain things that you're going to want to look for. I would read this through to see what kind of things can cause a claim to be rejected at the front door, and make sure that your system's not making those type of errors before you even send something to us. So the next tool that you have for dealing with your claims and understanding the codes we're returning to you on your remittance statements is called the Edit Error Knowledge Base. Again, that's also found on the emedney.org website under the HIPAA link on the top tab on that page. And it's, when you open it up, you'll see a page that looks like this. And you have 3 different methods through which you can search to find out why you received a particular edit or error code, and what the potential cause was and what you could possibly do to fix that problem. The first search method identified by number 1 on the left is to search by the eMedney edit. That would be something you would do if you had a paper remittance statement or a PDF remittance statement, because remember, we're going to return the 5-digit eMedney edit code on those formats of remittance. On the next box, box 2, you have 2 ways, 2 different things you can sort for in this, and this is to search by HIPAA codes. On the left side is your claim adjustment reason code and remark code, and that's what you find on the 835 remittance statement. If you did a claim status inquiry on ePaces, then on the right side you could have entered the healthcare claim status code and entity identifier code that were returned in that response. So once you enter those codes, you would click Go in any of these boxes. The last one on the right is 3, search by title text. I'd say probably most people I have worked with have used either 1 or 2, but you can also search by the written wording that you're seeing displayed as well. Once you click Go, you end up with a result that looks like this. Now, there may be a list, so you may get a list of edits that relate to the particular codes you entered. So remember what I said, the HIPAA error codes that come back, the claim adjustment reason codes, the response codes that come back for claim status. There's a shorter list of those than there are eMedNI edit numbers, which are very specific. So you might enter 2 code numbers like this. You might enter this code number 107 that you see on this page. Do you see where it says the edit number first, then it says history record not found for adjustment or void. So that's the actual wording that goes along with this error that you have. But notice below it, it says claim adjustment reason code 107, okay? And then it has remark code not applicable. And then on the right it says healthcare claim status code was 35. So depending on what you were looking at when you got the message back, whether it was a remit or it was a claim status response, you would have entered either the 107 or the 35 or the 725 if you were talking about a paper or PDF remit, and we would have returned a response. Now, if you had used the 107 or the 35 to look it up, then there may have been other edits that also apply to that. So you might have seen a list appear, and then you have to kind of read through each of them to see which one seems to fit your issue. So if you notice, you keep on moving on, you see it gives you a cause. In this case, the provider hit the 725 edit saying that there's no history record found for an adjustment or void, okay? And the cause of this would be that the transaction control number, that 16-digit number that the provider put on the claim that they just sent to us, and it tells you which loop and segment that would appear in. They're trying to tell us that they're trying to do an adjustment, but we can't find that number within the system as a paid transaction control number. And the reason is that that claim may have already been adjusted. Maybe you already sent an adjustment in. So now there's a new transaction control number that represents this claim. Or maybe the claim had been voided, same idea. You totally wiped it out, so there's actually a different transaction control number on file, but once it's been voided, you really can't do anything with that transaction control number that was created. It could even have been denied, and you're trying to utilize a denied transaction control number, which you cannot do if you're trying to do an adjustment. So it then gives you the solution, and it tells you some things to check on, make sure these things are accurate. So it tells you to look at the history of the claim, because it might need you to do some research on your remittances to see if it was actually paid or adjusted or voided or even denied. Then it wants you to take a look at the adjustment and void fields, because those adjustment and void fields, there's a number that would be entered on an electronic file. 7 for an adjustment, 8 for a void. Those should only be used if you're trying to adjust or void a previously paid claim. So you shouldn't be filling in these fields, the transaction control number or the adjustment or void field, if you're trying to rebuild something that denied or you're trying to do a new claim. So it's really important that people understand this. This is one of the big things that I see out there. And particularly, one of the things that Gwen brought up during her sessions that she did a couple of weeks ago is the fact that, providers are not billing everything accurately and are leaving some money on the table. And maybe they should have put additional procedure codes on their claim, or they should have billed with units, things like that. If those claims have paid, if they have said the word paid, then providers need to understand how to adjust claims in order to fix those type of errors. And it's really important that you use the appropriate transaction control number and the appropriate adjustment void code in order that we understand what your intention is when we receive the claim from you. Okay, next we have our slide about ICD10. It's really important that providers are aware of this. If you haven't been paying attention, you need to be. On my slide, you'll notice if you go to the medme.org website, when you first sign in, it's going to give you this big pop-up window that says, attention, ICD10 compliance date is October 1st of 2015. And it tells you how many days, hours, minutes, and seconds are left. And it's asking you, are you going to be ready for this? What we're finding is that we're not seeing as much testing as we would hope providers and vendors would be doing. It's actually kind of minimal. So this site, when you see this pop up, it's telling you we're ready for testing. We've been ready since last July. You need to make sure that the testing has been done, that you're following the rules for submitting the testing, and that you're going to be ready to use the appropriate diagnosis codes, diagnosis and procedure codes when time comes in the fall. So again, this particular slide that you're looking at was a snapshot I did from last week. So it's much less, it's less than 91 days at this point. So if you come to this site, you'll notice the pop-up window's there, but you can either click through this and go to the testing is open link, or if you look underneath it, there's a page there that says FAQs. So when you go to the ICD-10 links on the emedme.org webpage, you'll find there are frequently asked questions there that explain how your billing is supposed to be done, particularly if you're talking about, maybe you have dates of service that are old dates of service where you need to use ICD-9. Maybe you have new dates of service after the cutoff date in October where you're going to need the ICD-10 diagnosis codes. There are links to all sorts of resources for you to get up to speed on ICD-10. So it's really important that you get in touch with your vendor, that you talk to people within your organization, and that you are doing this ICD-10 testing and that you're ready for this when the time comes. And read through these FAQs, understand how it's going to impact your billing. So at this point, I think we are at the point where we were talking about, actually I'm going to back up. You can see on this slide the ICD-10, some of the additional ICD-10 information that's here. We talk about the testing dates, the FAQs, and then on the right, there's a whole bunch of documents and resources and training from other sources that you can link up to on the right-hand side of the screen. So I think now you have a poll question.
Yeah, so this is Dave. So we're going to take a break here. One of the things that would be helpful for us is to understand a little bit about what some of your most common claim denial reasons are. So if you could go to the poll question, we'll keep this open for 20 seconds or so. Give us an idea of what you're encountering inside of your billing shop. Okay, I think that's probably enough time. Brianna, could you key up the results for us? Okay, so it looks like about 186 no answers, but what we're seeing is the primary reasons for rejection are client eligibility and other insurance issues. Rita, do you want to speak to client eligibility at all, given that that's one of the key errors that we're seeing with folks?
Yes, and actually when we get into the next slide, I was going to show some of the information about that, talk about it, each of these. That's great.
Okay, so yeah, back to you.
Okay, thank you. Okay, so our next slide shows you what the common claim denials are. So as you take a look at this, and again, this is just talking about denials. I'm not talking about rejections. I'm talking about things that have gotten past the pre-adjudication point. So if you look at this, this table shows you the New York State edit. That's a 5-digit number that would appear on a paper or a PDF remit. The description, and then over to the right, the code number for a claim status response that you might receive if you were checking claim status on, say, for instance, e-paces, and the 835, your electronic remittance claim adjustment reason code and remark code. If you received those documents and you found the denial there. So you'll notice as you look through this list, these are, like the top 14 or 15 items, edit numbers and reasons why mental health clinics have had their claims rejected during a period of time recently. So we see the utilization threshold available, service exhausted edit. So that refers to Medicaid's eMedNI UT program that limits physician, clinic, and certain other services. And the way that you deal with that is when you check eligibility. Again, several of these you're going to find that eligibility becomes a key point here. So that's one of the reasons. You really should be checking eligibility and looking to see if Medicaid is saying that they've reached their UT limit. Not to be confused with UT as you describe it with mental health billing. This is something that's kind of a generic UT edit. Delay reason code 11 invalid, delay reason code 9 invalid. I can't stress enough the importance of billing your claims in a timely manner. Medicaid on our emedni.org website has a listing of the timely filing reasons, and you can get to it through various routes, but it's in your provider manual in the information for all providers. It's also available if you click on the information link on the emedni.org website. There's a whole list of there's a couple of different things there for timely filing. There's a presentation that the State Health Department did about it. There is a frequently asked questions document there, as well as the actual links to the delay reasons themselves within the manual. So it's really important that you read that through, that you understand it thoroughly. Delay reason 11 invalid is talking about the use of the reason that's used when you have an adjustment or void, and it's used primarily for that purpose. It's also used for a couple of other purposes, but mainly it's when you're dealing with the adjustment situation where you have to adjust a previously paid claim. So if you don't use that in accordance with their instructions for timing of when you can use it and in what circumstances you can use it, you're going to hit this delay reason invalid, 11 invalid. Delay reason 9 invalid is a big reason too. Delay reason 9 is the reason that you would use if you were submitting a claim late, and it was late because the original claim was rejected or denied for a reason that was unrelated to the timely filing rule. So when you read that rule, it says you have 60 days from the time that you billed Medicaid and received a denial. If it's now late, you have 60 days from that time that it was denied to turn that claim around and send it into us correctly with this as your late reason. So you can't, the reason somebody might get this edit 2164, delay reason 9 invalid, say for instance, you billed us a year ago you got a denial, and now somebody discovers, oh, look, we never got paid for this. Let me rebill Medicaid and put delay reason 9 on the claim. Well, it's been too long to rebill it. Remember they said you had 60 days to resubmit the claim with that as your late reason if your claim had denied for something unrelated to timely filing. So if you had, you know, originally billed with a wrong client ID or a wrong procedure code or something and got a denial for, you know, errors due to your information on your claim, you're not going to be able to use this if you wait too long. So that would be a reason why you would hit this delay reason 9 invalid. And there are other reasons, but you really have to read through that timely filing information and make sure you understand how you're supposed to use those late reasons. Delay reason 1007, or excuse me, not delay reason, edit number 1007, the through service dates greater than 90 days. So that's another, that's the reason you're going to hit on an institutional claim when you didn't put a delay reason on the claim at all and you're sending it in late. And you can see, now the next edit, number 1244, says service provider not active on the date of service. So some of these things occur when you submit a claim to us. If it's a clinic claim, you have to tell us who rendered the service. If you put a provider ID number on there saying who took care of the patient and they weren't enrolled at that time, you're going to hit that 1244 edit. 725 we talked about in great detail already. You know, somebody's putting adjustment void information on a claim that's incorrect. So they're either trying to adjust something that they didn't need to adjust, or they're using the wrong code numbers, the wrong transaction control number. The next one, 1007, Medicaid, coverage code 9, Medicare amount missing. Coverage code 9 is, you'll see that occur when the patient has Medicaid coverage for Medicare coinsurance and deductibles only. So we only pay if Medicare has, approved something first. So that means that there was some data on the claim that you either left off, or maybe we're not supposed to pay you for this because Medicare didn't approve it first. The next edit is 152, recipient file indicates Medicare and there's no Medicare present. So that's where checking Medicaid client eligibility is so important. You need to check to see if there's another insurance or Medicare on the client's file before you bill Medicaid. So this goes back to people during that poll talking about, you know, other insurance data being an issue. And this would be one of them. So you do need to check eligibility, make note of which insurance they have. If they have Medicare, make sure you check to see if it's a Medicare managed care plan that they're enrolled in, because that has to be indicated differently on your claim to Medicaid by showing us a claim filing indicator of a 16 to say it's a Medicare HMO risk or Medicare Advantage plan. The next one that you have here is 2067, attending provider not linked to the billing provider. You need to remember that any of the providers that are shown on a clinic claim also need to be tied to your clinic through the facilities NPI facilities registration page, and that's done. You can do that through the emedney.org website. There's actually a link on the tools section on the right-hand side of the screen. So it's the NPI facilities registration. So you actually have to tie a provider to your facility in that way. 705, service paid current or previously conflicting claim. That could happen because you already were paid by us and you just didn't notice that you were paid by us. Maybe you were trying to adjust a previously paid claim and you didn't put any original transaction control number or from the paid claim, or tell us that you were doing an adjustment. So we're thinking it's just a new bill. So it's important that you know what kind of bill you need to send before sending it out to us. The next one, 131, here's other insurance-related issue. So the third party has indicated the other amount wasn't submitted on the claim. So in other words, you need to tell us. If we see that there's other insurance, you need to tell us who that insurance is and what did they do and what did they tell you. In certain cases, you may have to tell us, maybe that other insurance doesn't cover it. Maybe they have inpatient-only coverage and you're doing an outpatient service, so it's something that's not part of that person's benefit package. You might be able to tell us that, yeah, I know there's this other insurance, it's not going to pay me anything, everything was non-covered. Next is 2081, all of the APG lines paid 0. So if we look at a claim and we see that none of the claim lines are supposed to pay, you're going to hit this particular edit. And then next, recipient ineligible on data service. And you mentioned that that is one of your big reasons for rejections or denials of your claims. That's also one of the big reasons that we see for denials of mental health claims. And you need to check eligibility each and every time the person comes to your front door. So you should be checking their Medicaid eligibility through the Medicaid eligibility verification system. It can be done using e-PACES or through sending us a software file that your software creates, or maybe a vendor is sending to us. You can also do a touch-tone phone or the swipe machine, like the little credit card machine where you swipe a person's card through it, the POS device. So there are different methods of checking eligibility, but you need to do something each and every time they come in to see if they're still covered by Medicaid. And if you don't understand the messages that you're getting back, definitely there's a MEVS manual that explains the eligibility verification system and its messages. If you need training, definitely contact us. We can try to talk to you about how to utilize that system and to understand the messages that are coming back. So do check eligibility each and every time you see the patient. And make sure, another issue I see too with this is that people aren't communicating what they're seeing. So, you might have a big organization and maybe somebody did check their eligibility, but their data didn't get all the way through to the billing department. So you're just assuming that everything's okay because no one communicated what they found when they checked eligibility. So sometimes it becomes a communication issue, and you might have to get a couple of departments together to say, okay, when you see this on the MEVS message, you need to let us know. We might need to talk with the client, or we might need to get a hold of, have them get a hold of the organization that, issued their coverage, or that's responsible for them in order to help them get it straightened around. Maybe they have a spend down. That's another reason you'll see recipient ineligible on data service. So things to think about. Prepaid capitation, recipient service covered in plan. That happens when you send us a claim and it should have been billed to the HMO, Medicaid managed care plan instead of Medicaid. Sometimes it occurs if you don't bill the claim correctly. So if you don't have the right information on your claim, like the right rate code, the right locator, zip +4, things like that, to help us to see that you're trying to bill for something that might be carved out of that managed care plan. So tips to avoid and correct your rejections and denials are listed on the next 2 pages. Follow the billing guidelines that are on emedney.org and the OMH website. Make sure you're entering correct coding, whether it be revenue codes, procedure codes, diagnosis codes, units, etc. Make sure you're following timely filing guidelines that are in your provider manual on emedney.org. Check the client eligibility each and every time using that MEV system. Include all of the other insurance information on the claim to Medicaid. And if it's a Medicaid HMO, make sure you use payer code 16 to make sure you're telling us it's a Medicare managed care plan. Make sure that the other payer amounts balance. In other words, the other payer paid amount plus the claim adjustments that were told to you by the other payer need to equal the amount charged. And if it's a zero fill situation where the other insurance isn't covering the service, and you can document that, enter that amount charged in the total non-covered amount in the other payer section. Make sure you're retrieving and reviewing your 277CA claim response files and or your claim status response files relatively quickly after you submit the claims. Retrieve and review your 835 or your PDF remits every week. Don't let that lapse. It can get costly to have them replaced and time consuming. And keep your E10 certification updated annually to avoid rejections. Confirm that the provider on your claim is linked to your facility and enrolled in the Medicaid program, even if it's through the OPRA, the ordering, prescribing, referring, and attending type of enrollment. Only previously paid claims can be adjusted or replaced or voided, and adjustments and replacements and voided claims require that 16-digit TCN of the paid claim. And they should be submitted with all of the date and claim lines, just as it should have been billed. That's key. Don't leave things off because you already were paid for them. Send us the claim if you're doing an adjustment the way it should have been billed. Sign up for the listserv. That's something on the Medicaid website where you can have messages sent out to you on various topics. And also make sure you're getting that Medicaid Update newsletter for important information. And if you need training, request it through the CSC call center at 800-343-9000. We have regional reps throughout New York State that can sit and talk with you, maybe a little longer on the phone than they'll be able to do at the call center. We might be able to do a webinar with you to go over your individual information or come out to your office. So just keep that in mind. And last here, here's some of our contact information. The emedme.org website is listed here. There's a contact form if you do need to send an email question to us. We can have it routed appropriately. And our call center, 800-343-9000.
Okay,
I'm all
thank you,
set
Rita.
here.
Yeah, thank you, Rita. That was really great. There's a lot of information there. We did have a number of questions that came in. We have about 20 questions that came in, but as you can see, we're bumping up right against the timeline for finishing up today's presentation. Rita, could you give me back the control here so I want to show people the follow-up for Friday's office hours. So what we're going to be doing is Friday at noon, we will be having our office hours, which you can have registered for. Rita will be on the call, and what we'll do between now and then is we'll put together all of the questions, and that will be primarily a session that Rita will just answer the questions that you've submitted during the course of today's presentation. Also, please, you can submit questions that come up after today's presentation. You'll see that submit your questions ahead of time to the ctac.info@nyu.edu. If you put the subject line dealing with claims denials, that will make sure that those questions will be routed to Rita. We'd hope that you'd get those into us ahead of time. I think that as I'm still watching questions come through, I think that there's probably going to be 25 or 30 questions that we'll be answering on Friday, and I think that you'll find that very, very helpful. So on behalf of CTAC, and we'd like to certainly thank Rita for her presentation today. It was very informative. A lot of people have questions. Please join us Friday at noon. We'll be answering the questions, and if we have time, Rita will show you some of the resources on the eMedme site. So thank you again, Rita. Thank you for joining us today, and hopefully we'll speak with all of you again on Friday. We'll talk to you then. Thank you very much, and have a great afternoon.